Hello everybody, thank you so much for clicking once again. This is Medicine on Air with Dr. Betha. Over the past weeks and months, we're admitting so many persons with diabetes mellitus and wounds on their feet, what we call diabetic foot ulcer. Diabetes mellitus, popularly called the sugar disease, is a disease that affects more than 850 million persons worldwide. It affects other organs and may lead to their damage if not well controlled. Organs include the eyes, the kidneys, the brain, the heart, blood vessels, and the nerves. It is because of the affectation of the blood vessels and the nerves that is why wounds in persons with diabetes do not heal well. Poor wound healing. So diabetic foot ulcer leads to amputations and even to death. Worldwide, about 7 million persons have their lower limb, the part of their leg below the knee, amputated. In fact, the estimate is that every 3.5 minutes, somewhere in this world, somebody is having the leg amputated. And after that, the risk of amputating the second one, about 35% of them get it amputated within 5 years. And so for this reason, I will be talking about foot care in diabetes. First and foremost, keep your feet clean. Wash your feet, dry them. Make sure they are dry. Inspect your feet every morning, especially in between the webs. Any little puncture, any little boil, any little blister could be the beginning and the harbinger of more terrible things to come. Number 2, your shoes. Wear comfortable shoes. In fact, they're actually shoes made for people with diabetes. But on your own, make sure your shoes are comfortable, padded. They cover your feet, not too tight, not too loose. Don't wear plastic shoes. For the ladies out there, avoid high heels, stiletto, because you could just lose a little balance and get a sprain. If the shoes are tight or loose, it can cause what? Blisters. Avoid shoes or slippers that expose your feet, like tongues, where it's just one, what is holding the feet is just one thing in between the first and second toe. Before you put your feet in your shoes, inspect the shoes. There could be an ant. There could be a scorpion in sub-Saharan Africa. There could be one sharp stone. There could be a sharp blade in there. And just that wound may cause a lot of problems. Number 3, avoid high-risk behaviors with your feet. These include walking bare feet. Because of the affectation of the nerves, persons with diabetes may not feel pain and heat the way every other person feels. So something can pierce your leg and you won't feel the pain. You can put your foot on something hot and you won't feel the pain. So avoid such. Always wear your shoes. Even inside your house, there could just be a little blade on the ground. In this rainy season, there is this poor practice. When there is flood, people remove their shoes and walk bare feet through the flood. Please, that's a very dangerous practice. The first function of your shoes is to protect your feet. Don't do such. There could be a sharp object there, a sharp stone, a sharp blade, broken bottle inside the place. Other things, don't cut corns and calluses from your feet. You could wound yourself and it's going to do what? Expand. Avoid things like hot water bottle, bathing with very hot water, touching hot things, because you may not know just how hot it is and you could get what? A burn. For your nails, it's advised don't cut your nails. You could have a small nick, so avoid anything that cuts, like nail cutter, razor blade, scissors. Instead, file the nails. In that way, you will not have what? A wound. So these are some of the practices to protect your feet. And if you do have any wound on your foot, please quickly go and see your doctor so that they can follow you with the aggression it needs. They control your sugar better, give some antibiotics, they may even admit. But even if they don't admit you, the most important thing you can do for yourself is to lift your feet off the ground, sit down and raise the leg on a chair. It's not when we give you excuse duty. You gonna be walking about, go to farm, go to market, cook, go to night vigil, and you're standing. No, your feet must be lifted off the ground for days, even weeks. In that way, it heals much, much better. Remember, every 3.5 minutes, somebody somewhere in this world is having the limb cut off. Don't let it be yours. Like this video, share it, that others may also know. Thank you so much for listening.